Hi, I'm Dr. Madhavi Reddy, Consultant Obstetrician and Gynaecologist from Yashoda Hospital, Hyderabad. Newly delivered moms usually will be facing some common issues in their regular breastfeeding, which we'll be discussing now. One of the very commonly seen complaint from the newly delivered moms is that they are getting very less milk supply after delivery. First, we have to understand that the normal milk production will start from 3rd to 5th day after delivery. First 2 days usually they will get very less milk, which will be seen as small droplets of water, what we call as colostrum. For getting good milk supply, usually we have to follow some steps. One of the very important thing is we have to make the baby breastfeed within 1 hour after delivery. The sucking reflex from the baby and skin to skin contact with the mother helps in establishing the breastfeeding. Meanwhile, if the mother becomes anxious and she jumps onto bottle feeding, then this skin to skin contact will be lost and the sucking reflex from the baby will not be there. So they obviously will end up in less milk production. Hence, to maintain a good milk supply, always start breastfeeding early and regularly feed the baby every 2nd hourly. Other common complaint what we will be seeing regularly is breast engorgement. Here the patient usually complains of heaviness in the breast, swelling of the breast and severe pain and not able to feed properly. All these will be seen. So for this we usually encourage mother to have a hot fomentation or take a hot shower, which will give some relief, followed by gentle massage of the breast. Then the breast will become soft to some extent and they should feed the baby. After feeding, they can check once again. If still the hardness is not relieved, they can take a breast pump and relieve the engorgement using the breast pump. Also, they'll have some problems with the nipples. One of the very commonly seen is cracks in the nipples. So this usually will be due to latching problems with the breastfeeding. So we have to properly train the mother about the latching positions, and the fissures can be superficial or deep. The superficial cracks usually heal within 4-5 days, but deep cuts sometimes they will take almost 2 weeks also for healing. So to get relief from the cracks, they have to adopt a good latching positions, and they can use their own milk for healing, or they can use some soothing ointments also, which they can apply after feeding the baby, and they have to wash thoroughly before feeding the baby again. Other nipple problems is flat nipples or retracted nipples. So most of the times with the flat nipples there won't be much problem. Once the baby starts feeding and baby starts sucking, usually the nipples will come back to normal position and they'll be able to feed the baby. But with the retracted nipples, the baby will have some problems for sucking. So we usually encourage mother to use the syringe technique for the retracted nipples, followed by breastfeeding. Also sometimes mothers will be seeing some white spots over the nipple and rash over the areola and severe itching over the areola, which we routinely call as a fungal infection. Whenever they identify such problem, they have to meet the gynecologist and they have to take antifungal tablets or ointments for the relief. Sometimes mothers get high-grade fevers, severe pain in the breast, and there is redness of the skin over the breast, which we call as mastitis. This is usually called as an infection, bacterial infection. So whenever the breast is not emptied completely after feeding, the breast can get engorged. The milk, whatever is collected inside, it becomes a focus for infection. So in this condition, they have to meet the doctor immediately and they should be started on antibiotic and some painkillers also for the relief. So with the proper coverage of antibiotics, most of the times the infection will come down. Even during taking the medication, they have to continue the breastfeeding. If the medication is not started in time and the treatment is delayed, sometimes this infection can become severe and an abscess can form in the breast. For this condition, they may need to go for the surgery. So always whenever they find such problems of high grade fever, they have to meet the doctor immediately. Most of these issues will be seen in the mothers who have delivered for the first time, and these problems will be seen most commonly in the first 15 days. So with the proper guidance from the gynecologist and from the lactation consultant, they'll be able to overcome these issues and they'll be able to happily feed the babies.